So dental implants are small titanium screws that can be used to restore either a gap in your dentition, or if you've got a failing root that we can no longer put a filling or a crown or restoration on the top of, it can be used to repair basically a broken root. A great many practitioners place dental implants now, but there are very few establishments that have over 20 years of experience in the field and the most highly regarded postgraduate training in the world. So dental implant works like this. This is a large model, just to give you an idea of what it is. So it's much bigger, so this is it in real size, but this just illustrates exactly what happens. So this is the screw that goes up under your gum line, so you don't see that at all. So that's placed in your bone where your root was. And then we can attach a little attachment on the inside of the implant, which then this bit sits under your gum like this. So this is coming out into your mouth, and then we can pop a tooth on the top. So there are many different ways in which we can use them. We can use them for just a single gap, so if you're missing a front tooth like this, we can pop an implant in. You can sort of see it through the model here. Or if you've got a gap at the back of the teeth, two or more missing teeth, we can pop two in and then hold a bridge off and pop them on like this. So there's a lot of different solutions that we can provide. The other thing that works really well is if you've got no teeth at all and you've been wearing a denture for a lot of years, then we can pop two implants in, much like this, on a bottom jaw, and it gives something for your denture to clip against, and it really stabilises a lower denture, which is a problem that a lot of patients have, a lower denture slipping around a lot. So this works really well for people, helping people with their dentures. The best thing about dental implants is that we can have a fixed solution, so something that doesn't come in and out of your mouth without compromising the teeth on either side. So that's the beauty with implants. For instance, in this front gap, in times gone by, it would be that we would have to prepare the teeth on either side in order to hold sort of a fake tooth in between. But with the use of dental implants, we can place an implant in the gap and then hold a tooth off that, which looks very natural and aesthetic without compromising your own teeth. So with dental implants, there are a number of different protocols in terms of treatment timings. If your tooth is already extracted, you can expect that the treatment in full could take as little as 3 months. So when the implant goes into the bone, it will take a period to set in the bone and then be strong enough that we can hold a tooth off it. So normally, the sort of quickest amount of time that you'll get the treatment completed in is 3 months. There are obviously, like I say, different protocols for treatment timings, and if your case is more complicated, or sometimes you don't have sufficient bone, or there's a range of different problems that we may come across, it can take a bit longer, up to 6, 9 months, even a year, but we will always provide you with a temporary solution in between times, so you'll have some sort of teeth in any gaps, or if you were wearing a denture previously, sometimes you can wear the denture over the implants that are setting underneath the gum. In terms of the actual surgery, we do a lot of IV sedation, which really takes away from the amount of time that we work on you. It's just, we pop a little cannula in the back of your hand normally, and we give you some medicine which makes you feel much, much more relaxed about the situation, and you can just drift off to sleep, although you're still conscious, so we can still chat to you and ask you to open your mouth more. And you'll be able to respond to our verbal command, but you'll be very unaware of the amount of time that we're working on you. So we could work on you for 2 or 3 hours, but actually you'll feel like you've been in the chair for 20 or 30 minutes. So that's a really helpful adjunct to the implant therapy. So that's something that a lot of patients do use, is sedation. In terms of pain, most patients report very little post-operative pain. So often more post-operative pain from routine extractions than they do from actual implant placements, but it is possible that you get a little bit of bruising, and we normally advise you on treatment timings, not to be going to function the next day or something of that sort, but we'll obviously advise you on that as and when if you come in to have a full consultation about it. Implant dentistry is a really fast evolving discipline, and with our strong commitment to continued education and patient satisfaction, you can be rest assured that we will provide you with a gold standard of care no matter how complicated your case.